What are medical X-rays? X-rays are a sort of electromagnetic wave, the same as visible radiation. Unlike light, however, X-rays have higher energy and might have most objects, including the body. Medical X-rays are accustomed to generate images of tissues and structures inside the body. If X-rays traveling through the body also have an X-ray detector on the opposite side of the patient, a picture are formed that represents the shadows formed by the objects inside the body. How do medical X-rays work? To create a radiograph, a patient is positioned so a part of the body being imaged is found between an X-ray source and an X-ray detector. When the machine is turned on, X-rays travel through the body and are absorbed in numerous amounts by different tissues, reckoning on the radiological density of the tissues they taste. Radiological density is decided by both the density and also the number of protons in an atom's nucleus, of the materials being imaged. For instance, structures like bone contain calcium, which includes a higher number than most tissues. Thanks to this property, bones readily absorb X-rays and, thus, produce high contrast on the X-ray detector. As a result, bony structures appear whiter than other tissues against the black background of a radiograph. Conversely, X-rays travel more easily through less radiologically dense tissues like fat and muscle, likewise as through air-filled cavities like the lungs. These structures are displayed in reminder gray on a radiograph. When are medical X-rays used? Listed below are samples of examinations and procedures that use X-ray technology to either diagnose or treat disease. Diagnostic. X-ray radiography detects bone fractures, certain tumors and other abnormal masses, pneumonia, some sorts of injuries, calcifications, foreign objects, dental problems, etc. Mammography, a radiograph of the breast that's used for cancer detection and diagnosis. Tumors tend to seem as regular or irregular shaped masses that are somewhat brighter than the background on the radiograph, i.e., whiter on a black background or blacker on a white background. Mammograms also can detect tiny bits of calcium, called microcalcifications, which show up as very bright specks on a mammogram. While usually benign, microcalcifications may occasionally indicate the presence of a particular style of cancer. CT computed tomography combines traditional X-ray technology with computer processing to come up with a series of cross-sectional images of the body which will later be combined to create a three-dimensional X-ray image. CT images are more detailed than plain radiographs and provides doctors the power to look at structures within the body from many various angles. Fluoroscopy uses X-rays and a fluorescent screen to get real-time images of movement within the body or to look at diagnostic processes, like following the trail of an injected or swallowed contrast agent. As an example, fluoroscopy is employed to look at the movement of the beating heart, and, with the help of radiographic contrast agents, to look at blood flow to the center muscle additionally as through blood vessels and organs. This technology is additionally used with a radiographic contrast agent to guide an internally threaded catheter during cardiac angioplasty, which could be a minimally invasive procedure for opening clogged arteries that provide blood to the center. Therapeutic. Radiation therapy in cancer treatment, X-rays and other kinds of high-energy radiation is wont to destroy cancerous tumors and cells by damaging their DNA. The radiation dose used for treating cancer is far on top of the radiation dose used for diagnostic imaging. Therapeutic radiation can come from a machine outside of the body or from a material that's placed within the body, inside or near tumor cells, or injected into the bloodstream. Are there risks? When used appropriately, the diagnostic benefits of X-ray scans significantly outweigh the risks. X-ray scans can diagnose possibly life-threatening conditions like blocked blood vessels, bone cancer, and infections. However, X-rays produce ionizing radiation, a style of radiation that has the potential to harm living tissue. This is often a risk that increases with the quantity of exposures added up over the lifetime of the individual. However, the danger of developing cancer from radiation exposure is mostly small. An X-ray during a pregnant woman poses no known risks to the baby if the realm of the body being imaged isn't the abdomen or pelvis. In general, if imaging of the abdomen and pelvis is required, doctors value more highly to use exams that don't use radiation, like MRI or ultrasound. However, if neither of these can provide the answers needed, or there's an emergency or other time constraint, an X-ray could also be a suitable alternative imaging option. Children are more sensitive to radiation and have an extended lifetime and, thus, the next relative risk for developing cancer than adults. Parents might want to ask the technologist or doctor if their machine settings are adjusted for kids.